Hey, Adventure Riders. My name is Mark. I'm with Kytheramoto. We do topics for the adventure rider, making your trip hopefully a little less hazardous, a little more comfortable, and a little safer for your adventures in the backcountry. So, today's topic, we're going to talk about Rider Down Part 1. It's going to be a multi video type of thing. When things go wrong, what's the plan? A rider down. What is a rider down? Someone slips on some gravel and injures an ankle, or um, God forbid, anything worse. Whether the accident is on pavement or dirt or lost or has a medical injury or something like that, right? So coming up with a framework on what to do for these type of situations. Before we go into that, what I do want to talk about is, and there are some videos out there that really promote you guys to do first aid classes because you're in the backcountry and you're on motorcycles and it's a high risk sport. I'm a retired firefighter paramedic. Been retired for about 5 years, but I was a wilderness paramedic in the 90s, and I have experience in technical rescue, backcountry rescues, and things like that. So I want to give you guys a heads up on some things, right? If you want to take a first aid class, by all means, do it. You want to get certified? Go ahead. I think from Knowles taking a wilderness first aid class, um, any type of first aid, anything like that. But I want you to be aware of a couple of things that you should be aware of. First of all, is there any certification process that requires you to be associated with an organization like a volunteer fire department or ambulance company or anything like that, or government agency, things like that? So is there any requirements for that in order for you to become certified? Is there a certification process? And if there is, usually you are linked either sometimes to a physician, or you have continuing education or a recertification process every year. So there's a lot of things that go along with first aid certifications. If you want to take one and it's just for general knowledge, that's great, right? That's great. But remember, when you move from being a good Samaritan into the treatment phase, in other words, you're going to be applying treatment to someone in need. Oh, I took a first aid class 10 years ago. I'm going to splint your lower leg or do a traction splint of a femur fracture, something like that. Be aware there may be some um, ramifications behind that. So you just want to be careful. That's all I'm saying, is be careful about what you do, because remember, and I'm going to say this over and over again, the number one motto for first responders is do no harm. Okay? Don't do any additional harm. If you're not trained or you're not have a 100% chance that you're going to benefit the patient and have a positive outcome, then you're probably better off not doing it. And it's very hard. It's a psychological quandary to see someone in distress and not want to help them, especially if you have some training or some past training where you think you can make things better. Okay? So just be aware of that. Be aware of taking those classes. They're all great. They all cost a lot of money. Sometimes require travel, things like that. And that's super, super important. So I want to get that point across to you about taking first aid classes and wilderness first aid classes. My coffee machine is shutting off right now, so it will go off here in just a second. Hopefully you don't hear it. So solar adventure motorcycle riding, you guys know this. This is a risky business, and the fact that, single track, double track, all sorts of things. There's a lot of ways of getting injured, right? And when heading out into the backcountry, we want to have a plan, right? Or semi-plan, right? So regardless of your travel mode, have an itinerary. I'm going to go to Mount Hood National Forest, and I'm going to travel the back roads for, a couple days, and I'll check in every afternoon before I break camp. So have an itinerary and share it. The ability to share your location and have someone track your progress is vital. It's very, very important. There's a lot of ways you can check in nowadays, which is really super cool. So there's many devices that exist. Now there's satellite communications on your cell phone is an option. I just have a new iPhone, the iPhone 17 something Max or whatever, and I was very much alive without cell phones, right? And a matter of fact, I got a little flip phone back in early 90s, and I remember being able to call my wife from the summit of Mount Hood and thinking it was the coolest thing ever. And then from there, it went on, not to get too sidetracked, but it went from there that, oh, you're really not in the wilderness if you're carrying a cell phone. Well, everybody carries cell phones right now. It's a very common and needed tool to have when you're in the backcountry. So again, you can, on your phone, your iPhone or whatever phones you have, this particular phone, you can communicate via satellite on it. So it will say, do you want to communicate satellite? A little Earth will come up and it'll show you a satellite, and you have to point the phone towards the satellite, and then it will connect, and then it will give you the options of doing messages and sharing location and things like that. I thought it was kind of cool myself, and it actually worked, right? So, and then you have your standard Garmin InReach, which really, really is good because that plays an important role in case of injury. So you have an SOS button that can contact a dispatch center, and you can and then actually message and communicate with the first responders that are on their way to your location. So really, really good to learn how to use that. Know that they also offer some air insurance and other insurance and things like that. I'm not going to get into much of that, but being able to communicate with your first responders, we're going to talk about that process here in a few slides. So again, the ability to communicate with responders is a welcome technology for sure. So what to carry and how to carry it, right? So first aid kits. All right, we're going to talk about first aid kits. If you look at this one over here on the right, it's got a lot of really cool things in it, right? It's got some Neosporin or back tracing. It's got some Blistex. It's got stuff for poison ivy. It's got stuff for mosquitoes down here. Athlete's foot. It's got gold bond powder. And when you're my age, and the Christmas ornaments have a little lower on the tree, you know what I mean? Gold bond powder goes a long way for comfort, for sure. So that's a good thing to have. And that's a good size right there. It'll last you your whole trip. Really selling myself out here, right? So you've got some tongue depressors, you've got some exam gloves. You want to protect yourself from any bodily fluids if you have the option of doing so. Don't try to play the hero in that regard, regardless of whether you know or not know the person, okay? And so this has got a more of a general wellness type of kit, and for minor first aid things, personal type of thing, it looks like. So, but there are kits with some more substantial items, like with SAM splints and tourniquets and large trauma dressings and things like that. We're going to talk about that in the next slide. So what should you carry? I'm not going to tell you what to carry for sure, but I mean, what should you carry? Well, adventure motorcycling is risky, right? So for me, it depends on the trip, right? If I have a multi-level first aid kit, or I'm going out on a week or 2 weeks or wherever, I'll bring a little more substantial kit, especially if I'm going out on with a group adventure ride or whatever. So if I'm by myself, I have just a little basic first aid abrasion-ish kit that I have in my backpack that I'll throw in, that I bought from REI or something of that nature, right? So Um, and if I'm going on a real extensive, like I'm going to do the Washington BDR, or the Oregon BDR, or now the Montana BDR, or Idaho, or wherever, and I'm going to be on the trail, and I know I'm going to run into other motorcyclists and things like that, I'll bring something a little more substantial that reflects my ability to apply treatment because of my background. So first aid kit should be readily available. Again, if I fall, I'm by myself, and I fall, I have my backpack, I have my first aid kit just in case I need something. That includes my ability to communicate and, have minor first aid, be able to apply that. So solo kits are in my backpack. Group aid kit is a little bigger, and I mount that on the outside of my luggage, or I'll put it in my top bag, roll up bag on my gear. So it's readily available. If I come across someone that is injured, I can pull that first aid kit out instead of going back and forth and back and forth. I'll just walk over to the patient with the kit. So be creative, right? And do what you feel is comfortable, how it reflects your level of care. So this is kind of some things that I carry on my big kit. I'll go over some things here. If you can see my mouse pointer here, this is a large Band-Aid, great for blisters, things like that. It's just super large, abrasions, things like that. I've got something for burns, but it can be used for pretty much anything. Chest seal as well for any large wounds or anything like that. It's got like a Vaseline type of coating to it, and it's designed to uh, plug any holes basically in the chest wall. But it can be used for multiple things. Here, something that I added, it's a 100cc syringe that if you just put some potable water in there, drinkable water, it gives you the opportunity to irrigate or flush out a dirty wound. All right, so it doesn't have to be sterile. It just needs to be forcefully use the mechanics of the water to clean any dirt or debris out of a wound and then bandage it up. So that will go a long way to reducing the chance of infection, bacterial infection, later on down the road when and if that person needs stitches and things like that. Various type of bandages, dressings, things like that. Some have some ointments on them, some doesn't. The SAM splint, it's really super universal piece of gear for first aid kits. But more importantly, and I'm going to stress this on our channel anyway, is that carry a foam sleeping pad. Foam sleeping pads, the kind you blow up is great, yeah, but they don't do anything unless you're going to lay a person on it, right? So foam pads you can cut with a multi-tool that you see down here, and you can make a splint, and you can splint any extremity at that point as well and lay a patient down on it. So that's a multifunctional tool. Foam pad, foam splint, if you will, that you can make from your foam sleeping pad. There's a tourniquet down here. Be careful with tourniquets. Get some knowledge behind on how to use it and when to use it. But the most important thing is to be able to apply a bulk dressing, or as much dressing as you possibly can, if you are in a stop the bleed situation. Here is a nasopharyngeal airway, just because I know how to use those. Other dressings. Most importantly down here is a little pad to write things down, right? I've got a 58-year-old male who crashed on his motorcycle on the pavement, slipped on some gravel. He's complaining of a lower leg injury, no loss of consciousness, no spinal injury that I'm aware of. It seems to be an isolated ankle injury, things like that, where you can write that stuff down and then communicate it to the first responders. Transponders, where did I get that? So some medical glue that you can glue some things. Don't get into that if you're not trained to do so. And leukotape. The leukotape is fantastic because it will stick to anything. Okay, it will stick to your skin and it's hard to get off. So it can be used for muscle injuries. It can be used for aches and pains. It can be used for blisters. It can be used for a lot of different things. Cold packs. We talked about this in a previous video. Um, yeah, hyperthermic heat injuries. All right, heat illness. Right, where you're have heat exhaustion or on the verge of heat stroke, where you're dehydrated and you need to cool someone down. Or if it's in the mid part of the day, they had a crash, they got an ankle injury, and they're just not able to move out of the sun, or somehow you need to keep that patient from heating up or is already heated up. A couple ice packs on the neck and in the groin area go a long way to cooling someone down. So if you're in a group, or even if you want to by yourself, carry some ice packs. They go a long way for heat illness. Various other tapes, cling tape and things like that, compression tape, hand warmers. Hand warmers, exactly what they are, right? They work great. For me, I don't have heated grips on my 890, but I just put a couple hand warmers in my gloves and I don't have an issue. An emergency compress bandage, things like that. Here's the point. Oh, and there's some Castile soap up here in order to wash my hands and things like that. So this I carry in my toiletry kit. So be creative and then be reflective of what your skill level is. So if I'm going on a group, or if I'm going to be on a trail or a BDR where I know there's going to be a lot of other motorcyclists or UTVers, or the potential for running into someone who is in need and distress, I will carry a more comprehensive first aid kit so I can render care if needed. So what are the priorities when an accident happens? Okay, these are some of the priorities. This gives you a basic framework and how to mitigate the situation, right? Just a basic stuff. So the first thing you can do, and is the best medicine, is stay calm and speak softly. Stay calm even amongst yourselves, and especially to the person in distress, right? So it's very hard to see someone in distress. It can get the heart pumping for sure. Take a deep breath and then go to work, right? A calm, reassuring voice can sometimes be the best medicine, and it's absolutely the truth. If you're going to talk to someone, maybe they're on the ground or in the sitting position or wherever, kneel down next to the patient. Someone should always be in communication with the patient, all right? And have a nice, calm, and reassuring voice that, hey, we're with you. We're going to take care of you. We're going to get you out of here. We're going to make sure that everything's okay, all right? What you don't want to do is stand over the patient in a group like you're in the last scene of Full Metal Jacket and go, we can't leave him here like this. So be cognizant and be mindful of staying calm and speaking softly, and that might all it takes, right? So that's great way of approaching it, and anybody can do that. Second thing you want to do, and again, another important point, is to protect the patient and everybody who is on scene. Protect yourself. Is the scene safe? Make sure the scene is safe. If you are on a blind curve on a road with truck traffic or any type of traffic, send someone up to flag traffic down and set up some motorcycles with your hazards on, or whatever you need to do in order to make that scene safe for the patient. Protect the patient as well. If you need to move the patient off the road, off to the side of the road because things are too dangerous, be very careful in how you move the patient off to the side of the road. And there's a ways of doing that we'll discuss at later date. And then also what do I mean by protect the patient is protect the patient from sun, solar radiation, the cold, the wind, the wet, the cold, and solar radiation, right? That's our theme on what we need to protect ourselves from. You also need to protect the patient too. So if you have a tarp, have something to, if you're in the hot weather, try to cool the patient down or keep the patient at a normal body temperature. If it's cold, you want to be able to apply some either clothing or um, sleeping bag or something like that where you can keep the patient warm until first responders arrive and extricate the patient. Next thing I want to talk about is someone needs to take charge. Very, very, very important. Okay, so it doesn't need to be the highest, most medically trained person. It doesn't need to be your team leader. It doesn't need to be, just someone needs to say, I'll take this, I'll be in charge, I will communicate with responders if you decide to activate them. SOS button, someone will handle the inReach or cell phone communication, and then also gather information and gather opinions from your group in order to come up with a plan. So someone needs to take charge. Care for the patient and gather information. We're going to talk about this in a little more detail in the next slide, but we want to care for the patient as best as possible, and we want to gather information on what the level of injury is, and we do that by doing a primary assessment and a secondary assessment. Very basic. A lot of it, 99% of it, is just asking questions, right? And then knowing what the mechanism of injury is, and we'll talk about that in another slide. We're going to develop a plan. Okay, what's the plan? Everybody's going to be looking around going, what do we do? What's the plan? All right, are we going to extricate the patient? Can first responders even get to us? Do we need to call a helicopter? You communicate with the inReach dispatch center, formulate a plan. If anybody's got ideas or suggestions, gather them around, come up with a plan, and then execute the plan. And make sure everybody knows what the plan is, keep everybody safe, and then execute the plan. So mechanism of injury. I want you guys to really know what mechanism of injury is, right? It sounds basic, but it's what it is. It's a mechanism, whatever the mechanism of the injury was. Did the rider slide on gravel at a slow speed and injure an ankle, an isolated injury? Did the rider fall at moderate speed, 30, 40 miles an hour, onto some good-sized rocks and has blunt trauma, is complaining of shortness of breath, maybe a broken rib, back pain, anything like that. So, that would be a clue or a red flag that something semi-emergent may be happening. So did the rider lose control and hit a tree? You can assume that something possibly serious has happened, God forbid. So, mechanism of injury. Was the patient on pavement or gravel? What's the difference? Pavement doesn't move, okay, and it's very rough surface, right? Did it have abrasion coat on, or abrasion fabric on, or not? Or on gravel, loose rocks, which acts like ball bearings, and the patient could slide on that and maybe not have some abrasions to the skin, may or may not. So, you're describing what happened. And I've got a 55-year-old female who fell off her bike, went down an embankment about 6 to 8 feet, and is complaining of right arm pain and some minor back pain. Something like that, okay? So you want to describe what the mechanism of injury was, write it down, and communicate it. So basic assessment. We're not going to go into super good first aid level detail, but we're going to go in. I want you to know what basic assessment is. What our goals here is to determine any injuries. And there are two basic types of injuries. Injuries that need immediate attention and injuries that can wait for aid, right? So most extremity injuries can wait. Fractures, things like that, closed fractures, things like that, which is probably going to be 99.9% of the issues anyway. So injuries that need immediate attention, patient's unconscious, maybe some neck pain, patient needs to be really stabilized, if you will. And if there's anybody around that has treatment skills, you'll know how to apply those skills and then also communicate those. So the primary assessment, your first assessment, it really is to determine the mental status and physical status. Ask questions. That's what it is. Like you go up and say, hey, Jack, what happened? Are you feeling okay? Do you have pain anywhere? Where do you hurt? My right lower leg hurts. I got caught under the motorcycle. I could feel it. I can't move my foot or my ankle. And, you just ask questions. Well, do you hurt anywhere else? Do you hurt anywhere in your neck? Do you hurt in your back? Are you having any trouble breathing? Do you have any other complaints? Just ask questions, right? Ask questions. Your secondary assessment is your hands-on, right? Is you hands-on, head to toe, right back. You start feeling and palpating all over and say, does this hurt? Does it hurt? And sometimes you'll get, ow, that hurts. My leg or my hip hurts. Then you record that down and you communicate it, right? It doesn't mean you need to apply immediate treatment to it. You just need to come up with a communication history and being able to communicate that to your first responders if you choose to activate them. So record any findings. The more information you can pass on to responders, the better picture they will have for a treatment plan. And that does what you're 99% there. That's the best thing you can do for that patient right there, is to be able to record these things and communicate and to your responders. So thank you very much for watching. This is all we're going to do with this phase right here. I like to keep these videos under 30 minutes. We do topics for adventure riders, making them hopefully a little less hazardous, a little more comfortable, and a little safer for you guys. I appreciate your time. Please subscribe and leave a comment. And I appreciate all that stuff. I'm just starting on this thing, so not super great at it, but I'm getting there. So anyways, thank you for watching. You guys take care.